Month and National Cancer Survivors Month, and this week, the week of June 9th through the 15th, as Men's Health Week, it is a critical time to shine light on an issue that too often goes undetected and undiscussed: prostate cancer. Today, we are proud to highlight the bipartisan House Bill 128, which seeks to establish a prostate cancer control program within the North Carolina Department of Health and Human Services. Prostate cancer is the most commonly diagnosed cancer among men in the state of North Carolina and the second leading cause of cancer-related deaths in men across our state. According to the North Carolina Department of Health and Human Services, from 2019 to 2023, prostate cancer trailed only female breast cancer in new cancer cases per 100,000 people. Despite its prevalence, prostate cancer is one of the most curable cancers if it is detected early. Yet far too many North Carolinians are diagnosed too late. The American Cancer Society estimates that in 2025, our state will rank in the top 10 for both new cases and deaths from prostate cancer. We can do better. House Bill 128 will create a dedicated program for prostate cancer, similar in structure and purpose to the existing breast and cervical cancer control program already serving women in our state. This legislation is about saving lives, about a higher quality of life, and giving our fathers, uncles, brothers, nephews, and sons the fighting chance they deserve. Every man deserves the same proactive support and access to care. Every family deserves hope, and North Carolina has the opportunity to lead the way. Now you're going to hear from Dr. Dan George.
Thank you so much, and I appreciate the opportunity to speak to you today. I'm Dan George. I'm a GU, or genitourinary medical oncologist, and professor of medicine and surgery at Duke University. And this is a fight that I'm in every single day. I've specialized in prostate cancers in particular, and treat many men with advanced disease, men ultimately who die from this disease. So I've seen what this can do to our individual friends and colleagues and loved ones. In addition, recognize that this is a population health issue. This is a statewide, nationwide concern that is really being undertreated. And it really dates back to 15 years ago when the United States Preventive Task Force put up a recommendation of D for prostate cancer screening, against prostate cancer screening. It was based largely on evidence that PSA did not change lives, and checking PSA did not stop people from dying of prostate cancer. And what's more, it led to more diagnoses of men undergoing treatment that was deemed unnecessary. Now, a lot has changed since that time. Longer follow-up of these studies show a survival benefit to prostate cancer screening with PSA. In addition, our practices have changed dramatically. So we've recognized the value of active surveillance. In places like Duke, and I'm sure you'll hear from UNC and other places around the country, have active surveillance programs in place to prevent and educate patients from overtreatment. It's vitally important to recognize we're screening not for prostate cancer, we're screening for lethal prostate cancer. We can absolutely tell the difference. It's so vitally important for people to recognize that knowledge is power. It's nothing to be afraid of. Understanding your cancer status is an opportunity for you to prevent a leading cause of death in this state. And this is absolutely something that has been shown to be done, and we've done it in our own communities. We need to do it statewide. Some of the biggest areas at risk are in our rural communities. And it's so important that we have a statewide, across-the-board program to address this need, not just in our areas where we have dedicated health specialties, but also across the state. And that's exactly what this kind of legislation will provide. Once these patients have a diagnosis, we can help them. But if we don't know, we can't make a difference. So please recognize that what we've done in breast and cervical cancer can absolutely be implemented and done in prostate cancer. And that these patients, these people, they make a huge difference in our society. We're not just saving one life, we're saving a family, we're saving a generation, we're impacting the lives of the people around them. So it's vitally important we recognize. And this doesn't start at a later age. We start prostate screening in midlife. Much like a colonoscopy, the first PSA is incredibly valuable in predicting who's ultimately at risk for this disease, not just of getting it, but of dying from it. So recognizing just that very first PSA of midlife can absolutely put us on a path of recognizing who is at risk and give particular peace of mind to the 90% of men who are not at risk. So this is not something people need to be afraid of unless you're at risk. And then we need to concentrate on that population, wherever they are across the state. This is absolutely why a state legislation like this is so vitally important to really changing those outcomes that have happened for year after year. I hear these same statistics every year, and they don't change. They only get worse. And it's only, despite all the treatment advances we make, we are not going to change these outcomes unless we change the beginning of this disease and diagnose these men when they're curable. Thank you.
Hello, my name is Eddie Goodall, and I showed up here 20 years ago from Union County, excited about being a freshman senator and being able to change the world. Well, that didn't exactly happen. In my first week here, I got a call from my urologist telling me I had a 7 Gleason and would probably need to come in and see him immediately. That I had intermediate to high grade cancer. So I did that, and he told me that I needed my prostate taken out the next week, which was a little hasty, I thought. I did some research. I told him, let's hold up, let me take a deep breath and just go back and look at, think about this whole picture here. So I looked at the Parton tables, which I'm sure that the doctors are familiar with. And this is a table men can go to and find out what their chances are based on their Gleason score, their PSA, and their stage of cancer. So it told me that my cancer was probably 30 to 40% out of my prostate already. So I went back and I said, now, if you take my prostate out and it's already out, will that make a difference? And I don't remember what his answer was, but I left, changed urologist, got the same prognosis by a different doctor, but at least he gave me more information. He knew what the Parton table was, made me feel a lot more comfortable, but I still said no. So, so at any rate, that was my surprise coming to the Senate. We had, so I elected watchful waiting or active surveillance, and I'm not sure which one it's called more often now. But so I kept that a secret. I didn't tell anybody. I had a brother die of cancer 5 years earlier, and my mother went through so much pain. I did not want to, even though I knew the limitations of prostate cancer. I knew it wasn't going to be as bad as my brother's. I didn't want her to know. So my parents never knew about it. But another gentleman here did, and some of you might remember him, Stan Bingham, Senator Bingham, was here. And Stan also got the same diagnosis and had similar numbers as I had. Senator Bingham told me he was going to have his taken out the next week. And I said, well, wait a minute. And I said, I've thought this through. Have you done this? You done this? You done this? What are the? And he didn't seem to know too many of his numbers. So he took a while to think about it, went to Johns Hopkins and came back with the same conclusion as me, that he wanted to wait too. So we as senators, me a freshman and him a sophomore, we decided we would do the active surveillance and see what happened, but pay attention to it. So we did. I did pay attention, and my PSA rather, the prostate specific antigen, the protein in your body that kind of gives you an idea of how much is there, how much cancer might be there. But my PSA went from 5.5 when I started to 101, which is not a good, triple digits is not a good number in prostate cancer. So I went to 101. I knew it was time to come in. I went back to my doctor. We talked about options, and I chose to, well, first of all, he did a bone scan and found out that somebody had gotten to me with a paintball gun and shot my skeleton because there were all these little dots in it that represented cancer. And so I still have that, and they're lying there dormant because they don't appear to be growing with new scans. I get a scan about every 2 years. So bad news there. Told I had 1.5 to 2 years to live. Changed my life because metastases to the bone is not good. The bones actually fracture as the cancer grows and cracks the bones. So very painful, and thank God I have not had to endure that. I may someday, but I have not yet, and pray that I don't. But many men do. Many men do. Very painful. So I started on Lupron, which is a hormone treatment that dries up your testosterone that's made by your testicles. It stops that production. Testosterone is the main ingredient. It's the thing cancer cells love to eat the best. I mean, it's their favorite item on the menu is men's testosterone. If you cut the testosterone out, the cancer cells may not grow as much, and that's the purpose of hormone therapy, this medication I took. So started that in 2018, which would be 7 years ago. When I started on that, they told me I had 1.5 to 2 years to live. And so kind of the same thing, but it's been 7 years, and I'm still here. And I'm very grateful for that. I was just going to say the testosterone went from 681 to 1 overnight, which is not good for a man. Men need testosterone, trust me. Hormone therapy is not great, but it beats dying and beats some of the pain that might go with letting your cancer go. So since then, since was hit with a paintball gun in 2018, I've had a concussion. I've had 3 mini strokes, a broken foot, cardio issues, many skin cancers. They don't biopsy anymore. Spinal stenosis, thyroid cancer, and that's just last year. No, I'm just kidding. No, I'm just kidding. I've had a rough time. But the other side of that, and the reason I'm here today, is I've fought in a jiu-jitsu tournament that my son talked me into. I was armbarred in 59 seconds, if any are MMA fans. I lift weights 3 times a week. I've written a book. I continue to manage my business. And that's the other side of this. I am very much alive. I consider myself very healthy, despite having stage 4 cancer, which I don't even use that term anymore. I just say I have cancer. So again, that's. Oh, and by the way, Senator Bingham passed away, but I don't know if his passing away had to do with his cancer or not. But he lived at least from 2005 to 2018, so he lived at least 13 years, and I've been alive 20 after our initial diagnosis. So I just want to tell men not to panic if they get a diagnosis of prostate cancer. Take a deep breath, listen to your physician, maybe 2 physicians if you want to. People that are your loved ones, and also other men, which is kind of the harder thing to do, I guess. I was talking to a gentleman this weekend, this is the truth, at a family outing, and he was telling me all about what his urologist had told him, and I got confused about all the numbers and what he was telling me, and I finally said, Bobby, do you still have your prostate? He said, I don't know. So that's an example of how poorly the message is out there for men. But they have to listen to these people. But the main thing is to have their own plan, make their own decisions after talking to all those other people, and that's the best they can do. Thank you.
Thank you, Senator.
Who's next? End of the line.
Hi, good afternoon. My name is Ray Tan, and I'm a urologist and practicing cancer surgeon up in Chapel Hill. And like Dan George, I'm very much in the trenches and see patients, make the diagnosis, take care of patients and men with prostate cancer on a day-to-day basis. And I just want to share that it's not uncommon for us to come across a situation where we're seeing a man in the prime of their life. They're still working, they're still taking care of their family, they can have young kids still, or they may be looking forward to spending some time with their grandchildren. And they come in with a PSA in the triple digits or something like that, and it really rocks their world. And it's something that in many ways could have been prevented with PSA screening earlier. And it's a really challenging conversation to have and to try to help them and support them and get them through it. What's good now, though, is that we have a lot of tools that we have at our disposal to really help figure out who's the best person to do a biopsy, to mitigate the complications of a biopsy, to decide what's the best treatment that, balances cancer control with the risk and complications with treatment, and even for patients with, advanced disease, how we can extend life. And, if we also have tools that we can really expand our reach and get people across the state from the mountains to the ocean, get them in to see and have a conversation with someone quickly. We can do it by the telephone. We can do it by video. They don't have to drive, an hour, 2 or 3 hours just to see someone. And with all these tools, if we just have some more support, we can really make a big difference in North Carolina. And so I'm really excited for this legislation. I think it can make a big difference, and hope we have the opportunity to sort of implement it here in the state.
Yes, good afternoon. My name is Victor Taylor. I'm from New Bern. I'm a prostate cancer survivor, and I want to just tell you my story. A friend of mine, Dr. Sidney Bonwell from New Bern, was doing a free prostate screening in Craven County. I had just gotten out of the military. I decided I wanted to take some men to get screened. In the military, I didn't get screened. After the military, I didn't get screened, but I wanted to do something for the men in New Bern. So I took 3 vans to the screening. And at the end of the last van, some told me to get up and get screened myself. And out of the 3 vans, I was the only one came back positive for prostate cancer. And in my family, there was no history of prostate, no types of cancer at all in my family. So I knew nothing. Didn't know what to do. So I got back with my friend, Dr. Sidney Bonwell, and he told me, number 1, to pray about it. Number 2, get a second opinion. Prior military, so I went to Durham and got a Duke, and they did another exam and came back with the same results. So at that time, I decided to have the surgery, remove my prostate, have the radiation. When I went back to the doctor the second time for a consultation, I guess, there was 4 specialists there in all white coats. So I was like, okay, what's going on? Am I getting ready to die or what? They just said, no, you're 44 with no family history or no types of cancer. We want to know why. I'm like, I don't know why. So they told me there's 2 choices. I had to do something or do nothing. And at that time, I said, well, cancer, at that time, I said, cancer is the death sentence. There's no choice. There's only one choice for me. At that time, we didn't have the technology that we have now. So I decided to go ahead and have the surgery, radiation, all that. And I told the doctor I didn't care what I did after 44. I wanted to make sure I was living after 44. So I decided to go ahead and have it. And I did. And at that time, I went back to my family's prostate support group, and I started talking to men. It's so important to talk and share. You don't know how many lives you save by talking and sharing. So I decided I wanted to go back, and then for some reason they made me the chairman, and we got one of the largest groups in the state of North Carolina just because I was talk. And I forgot to tell you, I was a city official for a little while, so I love to talk. So I decided, okay, that's not enough. Let me go get some more education from the specialists. So I started going around the United States to different conferences, different sessions to get information so I can share back in New Bern. And then I went from New Bern and throughout the whole state of North Carolina sharing information that I gathered to help men. You can survive cancer if caught early. And I just wanted to share that with you all. 99.5 survival rate for prostate cancer if caught early. Okay, so it's so important. This bill is going to help a lot for the rural areas, the ones that can't get get to the doctor on the regular, the specialists. So again, I support the bill 100%. Again, thank you for your time.
Okay. Firstly, I want to thank Representative Rodney Pierce for having the vision to introduce this potentially life-saving and transformative bill in service to the people of North Carolina. If passed, this bill will go a long way in bringing parity care to men, so it's highly appropriate that we're standing here during Men's Health Month and Men's Health Week. According to the American Cancer Society, this year alone we can anticipate 11,210, that's 7th in the nation, new cases here in our state, and 1,210, that's also 7th in the nation in regard to deaths. This is not good news. Death rates are rising. In order to bring our death rates down, we need to be better at making sure that men are not only aware, but they can access resources for earlier detection and high-quality patient care. Thankfully, our state's academic research centers are making great strides. In 2019, the North Carolina Advisory Committee on Cancer Coordination and Control issued a consensus statement on screening which illustrates the strongly aligned approaches of these centers and when it comes to screening and early detection. Had President Joe Biden been seen at one of these centers and had access to these innovations, he may be facing a much better prognosis. Effective and cost-saving care begins with early detection. Thanks to the work of Dr. Jan George and his team at the Duke Cancer Institute, we now have access to a novel screening algorithm that can be integrated into electronic health records, streamlining adoption of modern guidelines into our state's busy primary care practices in a way that is compassionate and custom to the individual man, the individual patient. This early frontline detection empowers that man to have time to evaluate his options for care and make the choice that is best for him, potentially avoiding a costly and unnecessarily advanced stage diagnosis while simultaneously reducing screening-related costs. What's more, we have UNC Urology's Rapid Access Pathway. This program offers a virtual care model that has the potential to reach the entire state and already serves patients from over 50 of our counties, cutting wait times for evaluation of concerning screening results in half, and therefore expediting access to important tools for understanding the likelihood of disease, aggressiveness, and appropriate action. The program reduces unnecessary biopsies and helps to streamline some of the most high-risk patients to appropriate care. Finally, we have stories like Victor's that remind us of the importance of comprehensive screening and the ongoing value of the relatively primitive digital rectal exam as a very cost-effective way of finding a smaller but still significant number of deadly prostate cancers. It's essentially the male equivalent to a woman's clinical breast exam. I was first introduced to prostate cancer in 1996 upon my father's diagnosis of metastatic prostate cancer at the age of 53. While he died of this horrible disease in 2003, he extended his prognosis of 1 year to live long enough to become a powerful voice for this cause, both statewide and nationally, and to found the Prostate Cancer Coalition of North Carolina in 2001, with myself and others by his side. It's hard to imagine that he isn't smiling down as old and new strategies come together, and we sit at the cusp of making the many advances in care more available to even the most underserved men in our state. Thank you so much for your leadership, Representative Pierce, and to the sponsors and co-sponsors.
Ladies and gentlemen, I do have some colleagues who have come in, and I wanted to give them an opportunity to speak as well if they'd like to. Representative Majeed? Representative Quick?
My name is Amos Lewis Quick III, and I say that because my namesake, my grandfather, Amos Lewis Quick Sr., died in 1991 at the age of 64 from prostate cancer because he did not go to the doctor and get screened. He was of that old generation that believed that it would just get better. He would just feel better on his own. It's in the 34, almost 35 years since my grandfather's passed. I miss him every day. And when Representative Pierce brought forth this legislation, and just the other day I emailed him and asked him for the opportunity to share my story and that someone may hear us here today, and it convinced them the importance and the necessity of getting prostate cancer screening, particularly African American men. Typically, prostate cancer, the prevalence of prostate cancer rather, is 1 in 8 men. However, for African American men, it's 1 in 6. And whether it's related to diet or environment or genetics, for some reason African American men are more likely to develop prostate cancer. So as an African American man who misses his grandfather dearly, who misses the fact that my grandfather never got to meet my children, his great-grandchildren, and they're wonderful children, I'm sure he would have enjoyed them. I want to encourage everyone, every man, and everyone who loves a man, particularly in the African American community, to push us men towards getting prostate cancer screenings, because you certainly will save a life. Thank you very much.
Thank you, Representative Quick. Any other colleague wanted to speak? Go ahead. Representative Lopez.
Good afternoon, everybody. My name is Representative Jordan Lopez. I serve House District 112 in the Charlotte area. I didn't plan on speaking this afternoon, so it will be super brief, but as just by a couple of years, the youngest person up here, I thought it was important to show up to this press conference because, as Representative Quick noted, this affects young black men at a much greater rate than anybody else. And since Representative Pierce introduced this bill, it's actually been a conversation that I have started having with my friends, with people who we probably wouldn't consider having these conversations as early as 26, 27 may seem, but because of acknowledging the need for more awareness, the need for people to be going to get tested, or at the very least asking questions to their own physicians, wanted to show up and show support for this bill. And I'm proud to have signed on as a co-sponsor with Representative Pierce, and just thankful for his leadership and for the folks who have showed up here today to speak on behalf of its importance, and then also for the work that's been done across the state to spread awareness about it. So thank you all for being here.
Thank you. Representative Monika Johnson Hostler, District 33 here in Wake County. Like Representative Lopez, I wasn't going to speak, but Representative Quick pulled on a few of the heartstrings. I stand here not to just support my colleague, which is extremely important to me. We're freshmen together, but also as a black woman who loves multiple black men in her life. Two very close to me. One was able to have a detection and test early at the encouragement of his wife, my aunt, and so for me, the advances really made a difference for him over the last few years. But another black man in my life was never tested, and I had the unfortunate opportunity to watch this riddle his life and his family's in ways that we now know could have been prevented. And I stand here before so I can also share it with the black man that I live with every day, that it is not just me who's encouraging him. There's a whole host of people, including friends, loved ones, but more importantly, those on the front lines doing the research to ensure that we are able to encourage black men like my husband, the importance of testing. But also, I think I'd be remiss if I didn't speak to the fact of encouraging black men to see physicians overall. We know prostate cancer and many other diseases riddle black men like no other because of the old adage that they'll feel better if they just drink water and rest. So thank you, Representative Pierce and my colleagues who sponsored and co-sponsored this bill that really, I believe, allows us to have a conversation and normalize black health for men as well. So thank you.
My name is Abe Jones. I represent District 38 here in Wake County. And I support this bill too. I support Representative Quick. I do want to say three personal things. My father had prostate cancer. He did not die of it, but he died with it because he chose not to get tested early, and he thought he was going anyway by the time he was going, so he didn't do it. I'm on the prostate committee here. The man I sort of adopted as a father, as my dad passed, he had it, he survived it, he's a survivor. It is a sneaky, nasty, tricky disease. It's ugly, and it kills black men at a higher rate. So I really support that we publicize, fight it, and be real honest with you. People don't like to test. There's a blood test and then there's a finger test. People don't like to be touched back there and so forth. I get it. But I get tested twice a year because of my daddy. And I don't want to get caught with it late. They catch it. If I get it, it'll be early because I get tested twice a year. I get tested on my birthday and I get tested in September when they have the prostate cancer month. And I'm just trying to say that's personal stuff. I thought I'd just put it on the table because it just haunts us. It's over our heads. It's the sneaky cancer, just like women have breast cancer that's sneaky. We have prostate cancer. That's sneaky. It doesn't give you a warning. It just comes on you. And so I just encourage all my brothers out there to please get tested. Please do it. Give up your pride for that few minutes in the doctor's office and get it done. Thank you.
Anyone else? Leave those all our speakers for today, so now we'll take questions if anyone has any. Ms. Bonner.
This might be a question for Dr. George, but anybody can
Okay.
answer. So I read this Preventive Services Task Force recommendation that men in a certain age group should discuss with their doctor whether they should have the test, but it sounds like you're saying it should be more routine. Am I right about that? Can you explain how this would work?
Absolutely. So the U.S. Preventive Services Task Force recommendation 2012 was against prostate cancer screening. That got revised in 2017 to a more kind of equivocal, it's between a physician and the patient, shared decision. But the damage was done. We had 5 years of this culture of not screening, and it's so hard to reverse that. And it's a shame, because while that data matured, more and more information came out about the benefits of screening and our ability to detect these cancers, our ability to monitor these cancers, so that we don't have to treat the men who have non-aggressive prostate cancer. We know the difference to that. In breast cancer, we have something called DCIS, which is a low-grade small cancer that we can also follow. In prostate cancer, we lump it all together in one name, but we can tell the difference between these non-aggressive cancers and the more aggressive ones under the microscope and with increasingly sensitive and specific tests. So we have that information. Most important thing for people to know is that if they have an elevated PSA, doesn't mean they have prostate cancer. It means they need to be evaluated. And some of that evaluation may involve a biopsy, maybe it doesn't. And we're learning better and better techniques to evaluate these patients. And so while those preventive task force recommendations are important, at the end of the day, what's most important is for people to be able to personalize that decision. For African American men who have a higher risk, to be able to recognize that and to be able to have the resources, the access to get screened. And as important as screening is also the information of what to do with it. It's not just having an elevated PSA or having a diagnosis. It's having the information, the navigation, all the services that come with this, and that all the things that this bill provides is really going to improve that access to help these patients make the right personalized decision for them.
This is aimed at men who are not insured, and people who don't have insurance have, less personal, regular relationships with doctors.
Yes, ma'am.
So isn't it kind of less likely that someone who isn't insured is going to go into a doctor and sit around and talk about, well, should I have this test or not? And
Right. Right.
And for someone who might be going to like a county clinic or something, and might not, see that person not less than
Going to
once a
the
year.
ER. Right.
How can you be sure that you're getting the right, you're getting good advice? I mean, Senator Goodall turned down the advice of 2 doctors. So, I mean, how is somebody to know, somebody who's not seeing regularly, that they're getting good advice?
Well, once implemented, Ms. Bonner, we would rely on the expertise of the North Carolina Department of Health and Human Services. The Breast and Cervical Cancer Control Program, as I understand it, screens about 12,000 women who are uninsured or underinsured. And the gist of the bill is to basically do the same thing with prostate cancer screening. So once implemented and passed, we rely on the expertise of that department to make sure that is done properly. I'm sorry, Ms. Simmons. Or did you have a follow-up?
No.
Okay. Yes, ma'am.
My question is for you. We mentioned that this is for uninsured, but it's also for underinsured.
That's correct.
people.
Yes, ma'am.
Assuming a little bit in Medicaid, perhaps?
So to speak, yes.
So, my question, you're proposing $2 million, and for the first 2 years of this program is the criteria for men eligible for this program.
Right.
But back in May, the U.S. House voted to pass a reconciliation bill which cuts about $700 billion from Medicaid,
Unfortunately.
a program that 3 million North Carolinians rely on.
Yes, ma'am.
So my question for you with your bill aimed at helping not only rural men, but low-income men, how do you think this will affect your bill from getting off the ground?
The Medicaid cuts? Well, it can have a very drastic effect on it. The thing that I've done is try to talk to people who are within DHHS to see what can be done in light of those proposed cuts that are coming down the pike, so to speak. I have spoke with Mr. Jay Ludlam, who is the North Carolina Medicaid, the Deputy Secretary of Medicaid under Secretary Sangvi about this program. Secretary Sangvi, I'll make a plug here, will be coming to my district on the 19th to Northampton County, excuse me, to Northampton County at 2 p.m. on the 19th. And this is definitely something that I'm going to ask him about to address to the crowd when he does that event. So just one of those things that you just have to deal with, and you try to work with the people again within DHHS to try to make it work if we're fortunate enough to have it passed and implemented. Yes, ma'am.
We've talked before, and
Yes.
you've called your districts, the target of this bill,
Mm-hmm.
the neglected northeastern North Carolina.
Neglected Northeast. Yes, ma'am.
And prostate cancer really affects your district, specifically Halifax.
It does.
The highest
Yes,
in the
ma'am.
state. This bill is supposed to be passed July 1st. If passed, it'll be effective July 1st, but
Mhm.
it's still in committee
Mhm.
since February.
Mhm.
What's next if July 1st comes back? Is it back to the drawing board? What does that look like?
I'll tell you what I was told a few weeks ago during budget. Nothing is ever truly dead in this building. That's what I've been told by colleagues. That's what I've been told by people who are not legislators. They may be lobbyists or things like that. So we're going to keep the faith. We're going to keep advocating and pressing forward. This press conference, having my colleagues here, having advocates as well as people in the healthcare field here, I think this is a great step to continue to push it forward and to shed more light on it. Having you all here as the press is a way to keep it in the public eye. And again, this is about saving lives. It's not even really political. We're using politics as a platform to get it implemented, but this is about saving lives. And at the end of the day, if you're not about keeping people healthy and saving lives, if we're not about that here in terms of our business, then what are we here for? Anyone else, young lady? No? Anyone else? Representative Ball, you came in. Did you want to have? You good? Okay.
You got it, Representative Pierce.
Okay. Thank you so much. Y'all have a great day.